Welcome, my name is Nicole Pezzino. I am the Wilkes University and Weis Markets PGY1 Community-based Pharmacy Practice Residency Director. I'm really excited to have you join us so we can share a little bit about what our program is and what really makes our community residency unique. Our community partners really is one of the things that makes our program unique. We have the opportunity as a regional grocery store to have that family environment where you're able to work directly with the vice president of pharmacy, the director of pharmacy, regional and district managers, and also have the opportunity to partner with Wilkes University and have the opportunity to work alongside some of our faculty, the dean of the university, as well as we partner with the volunteers in medicine where you're able to go and have an ambulatory care experience. Additionally, we partner with a dietitian who we frequently will do our patient care opportunities alongside. So the patients in our community are able to have appointments with both a pharmacist and a dietitian to really help take care of their more well-rounded taking care of that patient and promoting those positive outcomes. We also have really unique diabetes services that have been nationally recognized. We have diabetes self-management education services as well as diabetes prevention program. And again, those are done in a partnership with various members of our community, from the dietitian that we work with to psychologists who come in and help with the mental health component of it. One of the things I'm most proud of with this residency program is our opportunity to really individualize the experience to meet that resident's career goals. So we have our core learning experiences that we utilize, so from patient care to ambulatory care, management and leadership. We have a research component, a clinical project, and then also you're able to have a precepting and learning certificate program. Additionally, you have the opportunity to go into elective experiences. But something that I'm really proud of is the fact that as a resident, when you're coming into this program, we sit down and we learn what are your career goals. And we can help reframe some of these learning experiences to help meet your individual goals. So for example, our current resident is really interested in federally qualified health centers and hopefully one day becoming the COO of one of those organizations. And so we're able to really help her spend more time with our leadership within the company so she can learn those different conversations. How do you hire people? How are you having these interviews with people? But then also taking a look at the business plan aspect of when you're implementing these services, what does it look like? What questions do you ask? How do you make sure it's financially viable? Finally, when you're on the ground doing these services, having the opportunity to provide patient care through medication therapy management services, and we're part of the Pennsylvania Pharmacist Care Network. And so with that, we're able to see patients and be reimbursed for medication management opportunities. So it's been really exciting to be able to design this program and now have it implemented and see how it's really been impacting our community and the experiences that the resident has been able to take on. I graduated from the University of Pittsburgh in 2014, where then I went down to the University of North Carolina, Eshelman School of Pharmacy, and completed a PGY1 community-based pharmacy program with, at the time it was Car Drug, and then converted over to a Walgreens. And I was able to have an opportunity and be a care manager with the Astral Project. During pharmacy school, I learned all about the Astral Project, and really it was something that I was very interested in learning more about and having these unique experiences in how do we take care of patients in the community setting and how can we really elevate the role of a community pharmacist. And so it was then my goal to bring this back to Pennsylvania and create a residency experience in a community setting where we're really elevating what community practice is, and that's community pharmacists serve a community. We take care of patients within our community and collaborate interprofessionally to make sure that patient has optimal care. So I took all of the things I learned through my student life as an intern, then my resident life, where I was able to be a care manager with the Astral Project and integrated into multiple ambulatory care clinics, and created this residency program where I'm at now at Weis Markets in Schnecksville, Pennsylvania, which is right outside of the Lehigh Valley. And through this program, we actually do a lot of collaboration with a dietitian and other local community businesses, where we're able to provide really unique experience for the patients to be able to see multiple different providers that are all working as a team to help take care and manage their disease states in the community setting. I firmly believe that residents that come into this program should be excited about this opportunity to really elevate the practice of community pharmacy and really help to be part of this transformation that's happening in our community setting, where we're really taking care of patients, working in this interprofessional team, and really optimizing therapy for our patients and managing medications. So the resident coming in should be curious, excited to take initiative, really be interested in working hard and knowing that when we're working as a team and we're really providing this access to our patients, that we have a unique opportunity. So taking advantage of those opportunities and really showcasing that community pharmacists are #changing the world. Really the opportunities you have with the university at Wilkes University, with our pharmacy site at Weis Markets, and also all the other community partners that you have the opportunity to work with. I really believe that graduates of this residency program are interested in developing a skill set that would lead them into an area of leadership. So whether that be at a university setting in academia or in the community health center in a community pharmacy or maybe an ambulatory care setting, I think that these are really the skill sets that you're going to be exposed to and have the opportunity to develop through this residency program. As I was creating this program and recruiting for our first resident, it was my goal to really ensure that the opportunities that were available to the resident would really be rich and well-rounded, to ensure that the resident would leave this residency with a various skill set, from taking care of patients, collaborating interprofessionally, management aspect, and leadership opportunities. And as the environment of where we're currently at evolved, we had to slightly be flexible and change some of the ways that we're approaching our patient care. So we pivoted pretty quickly from our in-person diabetes prevention classes, med management, and DSMES to a little bit more virtual of an approach. And so I think that when I envisioned this residency initially to where it is now, it's not exactly the same, though I might argue it's better than what I was expecting, because I truly believe we have this opportunity to really show the value of a community pharmacist in the world we're in right now. Pharmacists are the most easily accessible healthcare provider, and our community resident is really having this opportunity to go out and help patients who might not be seeking care or might not be getting care that they normally were getting when they felt more safe leaving their house. And so we're figuring out ways to meet patients where they're at and help take care of them. And so I know Sydney mentioned about her drive-through flu clinic. That's one way. We also have virtual medication appointments with our patients where we're doing them via Zoom, via a virtual method. Maybe it's over the phone. And then our in-person ones, how can we make sure our patients feel safe, but also we're maintaining that privacy? So while it's not exactly what I had, if you had asked me a year ago what this residency was going to be and where it is now, it's not the same. But I'm proud of how we're able to evolve, how we're able to take the opportunities that we have and capitalize on them to give the resident a rich experience, to ensure that our practice site is continuing to elevate community practice, and also at the end of the day, make sure our patients are receiving this optimal care that really promotes positive outcomes. And so we really have this opportunity and this experience to transform community practice. Thank you so much for taking the time to learn more about our Wilkes University and Weis Markets PGY1 Community-based Pharmacy program. We're really excited and hope that if you have any additional questions, please don't hesitate to reach out to myself or our resident. Thank you again, and we look forward to you joining our team of community pharmacists who are #changing the world.